care I've received since I had diabetes and a stroke and atrial fibrillation as well has been superb. And I think mainly because I have an understanding of the basis of the disease processes. So I've been able to look at myself and think, this needs to change. How do I do it? I need to take responsibility for me to a greater extent. I can't just rely on the health service to just sort me out without having some input for myself. It's putting the onus on the patient to actually become involved in their own care to a point at which they need less input from the NHS with the amount of knowledge that they've got. That's the key thing. They need the knowledge, they need the tools to go and do the job for themselves and be aware that they're making themselves better. And I think that's the key for me. I do think there are things that patients are afraid to say, and that's generally speaking because the fear of the answer. If they don't know the answer, but they're frightened of what the answer might be, then they don't ask the question. Health coaching helps people open up because it gives them the ability to disassociate fear, if you like, from the answer, so that they are enabled to ask the questions which they really want to ask, but were too frightened before to ask because of the possible answers. And it's a very, very difficult area that has taken a lot of prominence over the last few years, and it's developing nicely to give patients the opportunity to speak their mind without fear. Peer support, I think, is absolutely key, because there are some patients out there who haven't had any training, quite necessarily because there's so many of them. They're too frightened to go to training, they don't want to go to training, they don't want to hear anything. However, they are more likely to speak to somebody who's suffering the same disease process that they are than they are to speak to a doctor or a nurse. I think the difference it would make, the training that we've been on would make to people, is it gives them a different aspect, a different angle to look at the same issue. What we also found on the training, that were a lot of different people in the room had got a different aspect. They did voice it, they were willing to voice it, and I think looking at it from several different angles actually gave more insight into the discussion, and because there was interaction at multiple levels, you remember it more. It has to be interactive and it has to be interesting, because otherwise you switch off and you don't learn.